Good afternoon, welcome to Radio Sangam 107.9 FM. We have a new voice, it's me, it's Jannat, hello. Okay, so our studio hotline is 01484 817705 and our mobile number is 07444 202 155 if you want to message in. Now, today, we've mixed it up a bit, we have an interview and we have a few guests with us today. So we have Claire and we have Zubair. Hello.
Hello.
Hi.
Hi. Okay, so basically you're here today to kind of tell us about this NHS apprenticeship and health support worker kind of training thing you have going on.
Yeah, that's
so
right.
Do you want to introduce yourselves first? So we'll start with Claire.
Hi, I'm Claire. I work for South West Yorkshire Partnership NHS Foundation Trust. I know it's a bit of a mouthful.
Yeah.
And my role's in human resources, but I'm also involved in workforce diversity and healthcare support workers and apprenticeships.
Cool. And Zubair?
Yeah. Hi, so my name's Zubair. I work for the same trust as Claire does. So my title is Cognitive Behavioural Psychotherapist, and I'm based at Folly in Huddersfield, and I work for the IAP team, which basically stands for Improving Access to Psychological Therapies. So I provide psychotherapy to pretty much all of Kirklees, Calderdale, and for people who are suffering from mood-based or anxiety-based mental health disorders.
Right, cool. So we have some very experienced people today with us. So on Thursday, 22nd of November, there is an event happening at Folly Halls, right?
That's right.
So when are these sessions and what is it about?
Okay.
Kind of thing?
So the sessions that we're running at Folly Hall, they're information sessions for people who might be interested in working for the NHS in roles of a healthcare support worker and might be interested in doing a healthcare apprenticeship with us if they haven't done one already. So it's basically an information session, so we're going to do two sessions on the 22nd. First session's 2 while 4 and the second session is going to be 5 while 7. You'll have the opportunity to meet some of our apprentices and hear their stories, ask them questions, find out more about the trust and what the trust has to offer, and get some tips and advice and interview skills, things like how to complete application forms, how to find NHS jobs, book applications, that kind of thing.
That's really cool. So yeah, is there a kind of what do you need when you go to these events?
Okay. I mean, basically, what we're looking to do is to just tell people about the Trust, South West Yorkshire, because we cover a really large geographical area. We cover Kirklees, Calderdale, Dewsbury, Wakefield and Barnsley. We're predominantly offering mental health and learning disability services to local communities, but in Barnsley we've also got some physical health care services as well. We've got vacancies in all those areas, so we're looking to promote those. We've mainly got vacancies on working on the wards. We don't have posts working with children. I know some people like the posts working with children, but we mainly work with adults. And most of the wards we work on, most of them are 12-hour shifts, and some are regular, like 8-hour shifts, but most of them be 12-hour shifts. Just to give a bit of a feel for
the whole environment.
For the whole environment.
Yeah, that's really cool. So, I mean, why would people want to join the NHS to work for them and stuff like that?
Oh, that's a really good question. I mean, Zubair will be able to help a bit with this as well.
Yeah, so I only started working for the Trust in September, so I'm quite new to the Trust. I was working for it in a different part of the county before, so I'm quite new to the Trust.
Right.
And I guess essentially when I joined the Trust, there was a real emphasis on the Trust values, that it promotes respect, equality, integrity and dignity. And there was a real kind of push to promote the Trust values and the Trust mission to provide good physical and mental health care to the population. So initially when I joined the Trust, I was really quite surprised about the missions, the value statements that they're really pushing towards. As a new employer for the Trust, I guess in my role, essentially, because I work with such a diverse population, I guess there was a real push for the workforce to reflect that as well. So obviously the radio station's based in Huddersfield, we have people from the South African background, Pakistani background, Indian background. We have such a diverse population. And I guess the NHS is really pushing that we have professionals who can meet the needs of those people of various backgrounds. So it's a really good feeling that the NHS is really welcoming, especially this trust, that they're welcoming professionals from diverse backgrounds as well. And I think what I was really impressed by, that when I started working, within the first week I was invited to the trust induction. And this was quite odd because the CEO himself, Rob Wester, was actually present at the induction. And having worked for various trusts all over England, that I've never seen that kind of down-to-earth kind of human approach, that the CEO kind of themselves come to value each employee. And what I was really impressed with, they talked about power imbalances, that often in various NHS trusts you have a lot of power imbalances. For example, the kind of registrars, consultants, doctors are kind of considered somewhat more valuable, so to speak, and whereas assistant posts where you get support workers and whatnot are not as valued as such. And unfortunately that is true in some NHS services. But what I saw in this trust, that they were really breaking those barriers. They were kind of really pushing the value statement that we are equal. There is a sense of equality, and regardless of what banding or post you are in, you will get the same treatment. You will get the same opportunities to develop. And that was really refreshing to kind of hear. So that was really good.
That's absolutely right. And I think the post that we're talking about next week, Zubair was talking about the professional post, and obviously you mentioned non-professional, didn't you, as well? And they're the ones that we're pushing next week. They're the ones we're promoting.
Absolutely.
Because what is talking about all the values and behaviours, and our recruitment process for the healthcare support workers is a values-based recruitment process. So what we're interested in is the person and the person's passion and caring nature and what they can offer. It doesn't matter if they haven't got experience. They need some level of academic qualification, but for our maths and English, but it's about the person and who they are and what they can offer. We can teach them everything else, and obviously we've got career pathways for the unregistered workforce, the healthcare support workers, so that come in as a band 2, level 2, and then they can do some training and development, and there's opportunities for them to look at a band 3, the next level up, and then band 4s as well, which is a level above that, and that's looking at your training nurse associates or associate practitioner posts. So there's we've put a lot of work as a trust into trying to develop that band 2 to 4 workforce and make sure that we are valuing all levels of staff within the organisation, not just the senior levels, which is just what Zubair was describing.
I think that's so important, because unfortunately in many places people are often reluctant to apply to the NHS because they feel they might not have enough experience, their qualifications may not match to what we're expecting, and that's a complete myth, and we're looking to break those barriers. So people come forward, we're looking at your personal qualities, and fingers crossed they should meet the qualities and the values of the trust as well. So we are, as
and that's
Pleasant,
what we're to as well. So when we're looking at that, and when we're next week we'll be talking about how we can support people and what they need to think about when they put in the application forms. But it's about them and their experience and what they have to offer us, and not that they've worked in this kind of role before. It's about them being a caring, compassionate person.
That sounds really ideal, because I know many people who go into kind of these unknown forms of working, so things like apprenticeships and things like probably working from the bottom, complete bottom, but you're given the trust of someone who is probably at a professional level, and it sounds like the NHS, they will really support kind of your career path, and they'll support how you develop yourself as a person professionally, and the fact you go based on purely this person's personality almost, that is incredibly important.
To do the qualification, if people come to work for us and they haven't got a level 2 health and social care qualification, then we'll support them to do that apprenticeship. If they come to us with that, then we will employ them as a healthcare support worker. We employ both as healthcare support workers. We don't recruit, we don't offer apprenticeships with no job at the end of it. We recruit into vacant posts, and as part of that post then we'll offer the apprenticeship pathway to people who haven't got the qualification. But like I say, they will need to get into the course. They would need to have maths and English qualification. So
yeah, that's incredible, really. So the place Folly Dolly. I was saying Folly Dolly Falls. Okay, so Folly Hall.
Yeah,
that's it.
Yeah.
So it's right in the centre of Huddersfield, right? So and you do how many events a year? Did you say?
Right. We do a few events a year. Well, within the local communities, I mean, we went to Alhitma last year, and then this year we're coming into Folly Hall and Huddersfield, so we're trying to move them round.
Yeah.
We do other things throughout the year, but in relation to these events, we just try and do one a year. We have to try and programme them in round other things.
Yeah.
So the Folly Hall one is the first time we've done the Folly Hall one, and it's the first time we've been invited to come in, which is lovely. We're very excited about this. Yeah. So we'll just hopefully encourage people to come along and find out more about us.
So what's the reach like? So how kind of so let's say I'm coming to you, based in the middle of Huddersfield. So where would you position me? Like, do you have the whole of Kirklees behind you?
Yeah, that's a good question. We've got posts throughout the organisation. So like I say, we cover Kirklees, Calderdale, Dewsbury, Wakefield, Barnsley, a big area. And depending, we normally recruit 4 or 5 times a year for these posts. So depending where the vacancies are at that time, we ask people who come forward to go through the values-based assessment process with us. We'll ask them to preference where they would like to work.
Yeah.
So if you live in Huddersfield and prefer to work in Huddersfield, you can preference for Huddersfield. Or if you're in Barnsley, you can preference Barnsley or Wakefield. And we'll try and look at where the vacancies are and place you in a slot that you would prefer to work in. We can't guarantee you'll get your first choice, but so we give people 1, 2, 3 preferences.
It's like university.
Exactly. Yeah. So we'll try and give you your first choice.
Yeah.
But at least we try and give you the geographical area that you want to work in. Even we can't give you the exact service that you want to work in. So we have those conversations with people.
That's really cool. Okay, so if you guys are listening at home or on the way to work or whatever you're doing right now, our studio hotline is 01484 817705 and our WhatsApp and text mobile number is 07444 202 155. If you want to ask any questions you feel like getting the answer to right now, then go for it. We have 2 really good people here with us today, so I'm sure they'll happily answer anything you have. So when people come to this recruitment event, I want to call it.
That's fine.
So kind of what's going to happen there? So are you going to give them hints and tips and stuff? Or?
Yeah, we'll have a little programme worked out. So we'll give people more information about the organisation. I mean, we are kind of doing that now, but for people that maybe haven't heard this, we'll give a bit more information about the organisation. We'll talk to them again about sort of the healthcare support worker roles, a bit about the qualification. We'll probably also tell them about the care certificate induction, because Zubair mentioned the induction event that you attended, didn't you? For healthcare support workers, anyone new to care gets a 2-week a care certificate package, which is like their 2-week induction into the NHS. So they have to go do the care certificate, they have to complete that. And they also get lots of the mandatory training thrown into that, and it gives them a nice introduction to the organisation. So they get 2 weeks kind of classroom based. They also, if they're going to be doing the apprenticeship, they'll meet the college assessors that they'll be working with. And then, so we tell the people about that at the event. We also give them some information about NHS jobs and where to look for jobs on there, because they may be interested in NHS but not necessarily interested in the healthcare support worker roles. So we give them some information about that. We also invite people. We try to find people from the local communities that we employ that will come along and talk. So last year we had Habib and Mamuna came along and talked a little bit about their experience of working for the trust.
That's really cool.
And this year, hopefully, Mamuna's coming again, and I'm hopefully getting someone else to come along as well to talk about that. And they can share their experience and their story and their journey of what it's like for them to come into the NHS and how they found that whole process.
I mean, Zubair, I'm sure you have some stories for us when you first joined. So let's say a new person from this scheme,
Sure.
or this recruitment come and it's their first day of work, they're absolutely petrified. They just want to get on with it, get out. How was your kind of first day experience of working with the NHS?
Yeah, I guess what I would really like to kind of stress that the trust is a really supportive kind of place to work in. The employees there, your managers, your colleagues, we pretty much work off a value-based system. So we're not looking at, what your background is, what your qualifications are, what your experiences are. We're looking at shared values. And I think it's because we have those shared values in the trust, we can provide a really supportive and healthy environment for you to work in.
Yeah.
So I guess when I initially started, my immediate line manager was really supportive. My colleagues were really supportive. And obviously you do feel quite anxious. It might be your first time in professional appointment, or it might be your first time within the NHS that you're having some form of employment. So you will feel a bit nervous, you will feel a bit stressed, a bit anxious, and that's completely normal. But do feel reassured that at the end of the day, there's probably everybody in that room, in that building, who's gone through the same stage as you.
Yeah.
So we're all there to help that person, support that person. And I guess just building on what Claire was mentioning, that we are, if you feel you're a caring person, if you feel you have these values, that's what we're looking for. And you might not even be 100% sure, do I want to commit to a caring profession or don't I? And I just encourage you to really come along, because you need to feel that atmosphere for yourself, to get a really good idea of what it is like working for the NHS. And there's a lot of benefits as well. And as Claire mentioned, it's about development. So you're developing as a person in terms of your personality if you're coming into the NHS quite young, and developing professionally as well. So all around, it's really good support network there for you. And as Claire mentioned, all the mandatory training is provided, and even that is supported and structured, so you can easily access that, and you feel quite comfortable and supported in that process as well. So there's no sense of isolation that you've just come into the NHS, off you go, do whatever. It's a completely supportive environment. And I guess from my background, because I work with quite vulnerable people with quite often complex mental health problems, these are people who are vulnerable, and therefore you need to have that caring sense in you, those values of integrity, respect, openness and honesty. And if you feel you provide that anyway on a daily basis, why not turn that into a career? Why not bring yourself into that caring career? And often what we see, just like Huddersfield, Dewsbury, Batley, it's a very diverse population. And what I've seen in my profession as a psychotherapist, that the diverse BME community is often reluctant to seek help for their mental health problems. And I'm really giving that a big push now, that we want a staff or a workforce that reflects those communities.
Absolutely.
And research often says that the patients often feel more understood because they're working with a person with a similar background, similar language, similar culture.
Right. There's lots of research around that, isn't there? And they do say, people do feel a lot more supported, and they have better recovery outcomes if they feel that that they will go into hospital and they will see people that they can identify with. That makes them feel, in the first entry onto that area, it makes them feel more reassured and more. They
feel so more relaxed. You can speak the same language. They feel understood. Maybe it's your cultural beliefs, religious beliefs. Again, this is a trust that doesn't discriminate. And even for people who are not from a diverse population, a lot of training, a lot of kind of awareness work is done within the trust. So you might not be a person from a BME community, but they will provide awareness and support, so you can support your patients a lot better and your clients.
That's really cool. Okay, so we have to wrap up now.
Sure.
We could talk to you for days. So thank you, Zubair.
You're welcome.
And thank you, Claire.
Thank you.
So do you want to, we'll plug in the last kind of, if you give us the details again, so people can come to the recruitment sessions and stuff.
Okay, so it's Folly Hall next Thursday, the 22nd of November. Folly Hall's on St Thomas Road in Huddersfield. There's the first session 2 well 4, We are providing refreshments.
Yes.
And then,
I'll be there then.
Yeah, just biscuits. Sorry, just biscuits. And session 2 is 5 or 7. If you are wanting to get more information about that, I don't know about contact details.
Oh yeah, sure. Okay, what to do is I'm sure you can go on the NHS website as well.
Well, if you go on to, I mean, I'll have to give you a website. It's employability at S for sugar, W, Y, T for Tommy, .nhs.uk, and you can book a place on there, or you can give myself or my colleague a ring, but I don't know if I've got the numbers out, so...
Oh, okay, no worries. What you can do then is, whoever's listening out there, I know you are, because we can see you listening, like, I can feel you listening.
Getting the vibes.
So, yeah, if you want, you can just call us in on the studio. It's 01484 817705, or just leave us a message on our WhatsApp, 07444 202155, and Claire and Zubair, I'm sure you'll be hanging out for quite a while, and then we can always pass your details along.
Yeah, that's
and
great,
we can pass on the Folly Hold descriptions as well. So thank you guys so much for coming
You're welcome.
in.
Thank you so
you.
much for having us. It's been great.
Yeah.
Thank you.
So, like, to kind of like summarise, it's basically a health support recruitment almost.
Yes, that's a drive around that, but also we can talk about other opportunities in the NHS
definitely.
as well.
So, like, if you want to join the NHS or even thinking about it, even if you're kind of reluctant, just go along. I'm sure there's plenty more friendly people there who can talk to you about it and answer any kind of questions. And so hopefully you've enjoyed listening to us guys, and we will see you later. Up next is Zubair, so enjoy and have a good day.
Radio Sangam in association with Haji Jewellers, 68 Hotwood Lane, Halifax, HX1 4DG. Providers of gold and silver jewellery for all occasions. Call Halifax 01422 342 553.